So stem cells, once they get into our body through an IV, they go and find distress signals. So once they find the distress signals, these stem cells that are cells that don't know what to become attach to these molecules and start to develop a new line of tissue. So it's almost like the first day in utero when your cells started to touch the stem cells in the embryo and you started to become alive. So we get a new line of tissue that's created here. Sometimes more than one stem cell treatment may be needed because you need more activation and growth over time. But stem cells look for tissues that are distressed, that are sending a distress signal, but also like hypoxic tissue. That means tissue that has low circulation and oxygen, like in your brain or in your organ structures. So these molecules are very smart. We're just beginning to understand all the possibilities with stem cells. Since we're using a stem cell that comes from your own body and we're putting it back in you the same day, then we are following FDA guidelines and standards that we need to follow for safety and efficacy for government standards. So we really enjoy this process. I think it's one of the most miraculous things in health I've ever seen. When it comes to healing disease, I don't think anything will ever be found greater than this, because these are the molecules that God gave us for our body to heal. We do have stem cells released all the time from our bone marrow and from our fat, just at low amounts. And a lot of times when we get older, stem cell release decreases, so we degenerate faster and faster and faster, and our body can't keep up with that. So what we're doing in this process is just doing what the body would have done anyway. We're just able to do a large amount at one time so we can get healing from head to toe. And some of the professional athletes we work on, one in general, one of our first treatments that we did here, a professional football player came in with a 50% torn medial collateral ligament and a complete tear through his meniscus. Now, still today, in this situation, they would have surgery and they would miss a year of their game, and they would have to rehabilitate and come back the next year. Well, this particular individual came up on a Friday. He missed that weekend and the next weekend, and then he played the third weekend at full speed, cleared by his team, ready to play. So we had he had a 3-week missing of football, and then he was right back in the game. So that's how incredible that stem cells can work in joints. But a lot of my patients come in for us to treat, say, one thing, maybe COPD or diabetes, but find that many other things in their body start feeling better too. So we don't even know all the wonderful things that stem cells can do in the body. But we're looking forward to answering any questions, and the future research with stem cells is going to be awesome.